what surprises most people is the service members' openness to this. So these are tough majority men. We do have some women, but they're giving art a try, and I think that surprises people, putting down their weapons to pick up a paintbrush.
Thank you very much for speaking with me.
Thank you for having me.
Sure. So to start off, tell me about how you decided you wanted to work with military populations in particular.
Yeah. So my second year rotation internship was at Bellevue Hospital, and it was with adolescents on a psychiatric inpatient unit. Mm-hmm. And I became very interested in psychiatry and psychology while I was on that unit. And then after I graduated, it was kind of a right time, right place, serendipitous thing, but there was a position open at Walter Reed Army Medical Center, which is now Walter Reed National Military Medical Center. So and it was an inpatient unit, inpatient psychiatry, yeah.
That's amazing.
And so it just kind of, for me, it was an easy transfer.
Do most of the people you work with come to you voluntarily, or are they hesitant or resistant to the idea of making art? It's not.
So majority, by the time they get to us, they've needed it, they've wanted it, they've been seeking out something, that will help. Sometimes at first they're a little hesitant, but then once they get to know the treatment team and earn, and the providers earn their trust, then they're able to kind of overcome that, and then they become very involved in the treatment program. And it's work for them, because for many of them it's the first time after, some of them 20 years or more, that they've sat back and actually began to process and discuss all of these things that they've done. And we're talking about multiple deployments, one after another. The greatest majority of our population at NICoE are their special operations, so they have a very high operation tempo. They'll come home for a couple months, and then they'll go again, and then they'll come back. And so you can imagine that starts to take a toll.
So how does a session begin? Are you working one-on-one in a group, and is there a specific project that you're proposing, or is it more a free?
That's a good question.
Tell me about how it looks.
So I'm very fortunate, because there is the legacy program is the 4-week program I was discussing earlier, and because of that, we were able to implement almost a standardized care program in the art therapy side of the house. And so they come to us, and every service member is given the opportunity to create a mask in the first week as part of a group. And it's one of their first or initial opportunities to sit back and start to express what's come up that week.
What are some of the images that you see? I
think I see mostly this split sense of self, or dual kind of duality mask images. So service members they're trying to understand the side of themselves that deploys, who they are while they're over there in combat, perhaps the side that has been injured, and then the side that when they come home, when they're trying to be with their families and leave all of that behind. Sometimes that, obviously there's some dissonance there, and sometimes they have conflict arise because that person they are when they're deployed comes out and their home life. And so I think many of them are dealing with that.
Is there anything that you've learned from your time at Walter Reed that you think people would find surprising, or that's hard to know unless you're there in the space?
I think initially when they come into the setting, they're a little hesitant. Many of them never created art before or haven't for a long time. And so I think what surprises people is both their willingness to engage, but also the power of what they're creating. Mm-hmm. And it gets me every single time. It's just, the outcomes are incredible. They have a lot to express. They have a lot of stories, a lot of memories that they're trying to work through. And that comes out in the artwork. And I think they're also very hungry for a way, this gives them a visual voice, right? They're hungry for a way to enable civilians like me, you and the community, to understand what it is that they've been through. And this is one of the things that seems to be working.